A 71-year-old man died after waking up to urinate at night, possibly due to a sudden change in blood pressure, heart attack, or stroke. To protect health and reduce the risk of dangerous situations at night, especially for the elderly, maintaining healthy habits is extremely important. Some seemingly harmless actions can potentially pose great risks, affecting the heart, blood pressure, and nervous system. Dear friends, today, I would like to share with you an important topic for the health of the elderly. Dangerous habits at night that the elderly should avoid to ensure safety and improve the quality of life. We all go through our youth and enter old age. This is a precious stage, but it is also the time when we have to face many health risks. Understanding these risks and knowing how to prevent them will help you live a happier, healthier, and more fulfilling life. First of all, the risk factors when waking up at night. Nighttime is the time when the body is susceptible to serious health events, especially in the elderly. Sudden changes in blood pressure, slow blood circulation, poor reflexes, or interrupted sleep can all lead to dangerous consequences. One of the biggest risks is stroke or heart attack. When sleeping, the heart rate slows down, blood circulation is less effective, and the body temperature drops, increasing the risk of blood clots. If you wake up suddenly, the heart has to work harder to pump blood to the brain, which can lead to an acute heart attack. To prevent this, the elderly should maintain a stable room temperature, drink enough water during the day to avoid thick blood, and avoid waking up too quickly at night. If there are signs of chest pain, shortness of breath, sudden numbness, and weakness, you should contact your doctor immediately. In addition, the risk of falling is a serious problem. Vision loss, slow reflexes, and loss of balance make the elderly more likely to stumble when moving at night. A fall can cause broken bones, head injuries, or long-term loss of mobility. To reduce the risk, install sensor night lights, keep walkways clear, use non-slip slippers, and, if necessary, use a cane or handrail when moving. In addition, sleep disorders are also a problem to note. The elderly often wake up many times due to the need to urinate, pain, or difficulty sleeping. Interrupted sleep does not allow the body to fully recover, causing fatigue, memory loss, increased risk of cardiovascular disease, and weakened immune system. Therefore, it is necessary to establish scientific sleeping habits, avoid drinking too much water before going to bed, and create a quiet, comfortable sleeping space. If insomnia persists, consult a doctor. In general, nighttime is a time when the body is vulnerable, especially in the elderly. Sudden changes in posture, moving in the dark, or not getting enough sleep can all be dangerous. Adjusting your lifestyle, maintaining a safe environment, and paying attention to warning signs will help reduce risks and improve your quality of life. 5 harmful habits at night that the elderly should avoid. Nighttime is a time when the body is susceptible to serious health problems, especially in the elderly. Below are 5 dangerous habits to avoid to ensure the safety of the elderly. 1. Sitting up too quickly, risk of blood pressure shock and fainting. When a person is sleeping, blood pressure is often lower than normal. If you suddenly sit up, the body's blood pressure regulation system has not had time to adapt, which can cause postural hypotension. The result is dizziness, lightheadedness, loss of balance, and even fainting, increasing the risk of falling. Especially for people with cardiovascular disease, sudden changes in blood pressure can lead to temporary cerebral ischemia, even stroke. When waking up, lie still for a few seconds, slowly turn to one side, sit up slowly with your hands, then put your feet on the floor before standing up. This helps the cardiovascular system adjust in time, avoiding blood pressure shock. 2. Do not turn on the light when going to the toilet, risk of serious falls. At night, the eye's ability to recognize space is impaired, especially in the elderly with macular degeneration, cataracts, or nearsightedness. If the light is not turned on when going to the toilet, they are likely to trip, slip, or hit obstacles, causing injuries, broken bones, or concussions. Falls are one of the leading causes of long-term disability in the elderly. It is necessary to install a sensor night light or a soft light night light to help orient the way without affecting sleep. At the same time, keep the walkway clear. Do not place obstacles to limit the risk of falling. 3. Drink too much water before bed to disrupt sleep. increased cardiovascular risk. Elderly people often have impaired bladder function, making them prone to nocturia if they drink too much water before bed. Waking up many times not only disrupts sleep, but also affects the cardiovascular and nervous systems, causing fatigue and abnormal blood pressure fluctuations. In addition, each time you get out of bed to go to the bathroom, you increase the risk of falling or stroke if your blood pressure changes suddenly. Therefore, you should reduce your water intake within 2 hours before going to bed and limit diuretic drinks such as tea and coffee in the evening. If you have frequent urination at night, you should check your kidney and prostate health. 4. Dressing too warm or too cold affects blood circulation and respiration. Body temperature changes according to the biological cycle at night. If you dress too warmly, your body will easily sweat, become dehydrated, have body temperature disorders, and even increase the risk of heat stroke in the elderly. On the contrary, if you dress too coldly, your blood vessels can suddenly constrict, increasing blood pressure, easily causing stroke or myocardial infarction. In addition, cold can also lead to pneumonia or respiratory failure. It is necessary to adjust the room temperature to 22 to 25 degrees Celsius. Choose breathable sleepwear. Keep warm but not too tight or stuffy. If it is cold, you can use thin socks, light blankets instead of wearing many layers of thick clothes. 5. Ignore unusual signs of the body risk of serious complications. Symptoms such as dizziness, chest pain, shortness of breath, cold sweats or numbness in the limbs can be warning signs of stroke, myocardial infarction, or unstable blood pressure. However, many elderly people are often subjective, thinking that it is just a symptom of normal fatigue, leading to delaying timely emergency care. In the case of a stroke, the golden time for intervention is only the first 3 to 4 hours. If missed, the risk of death or permanent disability is very high. Therefore, if you feel any unusual symptoms, do not take them lightly. Call 911 immediately if you have signs of a stroke or heart attack. Seniors should also have regular health checkups to detect and control underlying diseases. Nighttime is the time when the body is susceptible to serious health events, especially for the elderly. Habits such as getting up too quickly, not turning on the light when going to the toilet, drinking too much water before going to bed, dressing too warmly or too coldly, and ignoring unusual signs can all be dangerous. Changing your living habits, maintaining a safe environment, and paying attention to your body's signals will help minimize risks and protect your health better. Dear all, health and old age is a precious treasure, and we can completely protect it if we know how to take care of it properly. Hopefully today's sharing will help you maintain a happy, healthy, and energetic life. Thank you for listening. Don't forget to like and subscribe so we can continue sharing helpful advice together. Thank you for watching, and I'll see you in the next video.